I am preparing Luda here for her ovariohysterectomy using aseptic techniques. So we are on our surgical prep table right outside of the OR. So the first thing I want to do is I want to shave the appropriate amount of hair. So anatomically, I want to shave from the xiphoid process to the pubis and then laterally to the sides of the ribs. So I'm going to take my clipper. I have a number 40 blade, which is going to get me the closest shave to the skin. And I just want to shave all of the hair within that area and make sure that my lines are nice and straight and they're cosmetically appealing. I'm going to go ahead and shave her hair. Once enough hair has been shaved and my areas look good, I'm going to use a vacuum to suck up as much hair as possible. That way I'm not bringing any stray hairs into the OR. So there's no hair left over. I've got a nice, clean, straight line here. So I'm going to go ahead and do a dirty prep before moving her into the OR to do her final surgical scrub. So I'm just going to go ahead and put gloves on for this just to keep it as clean as possible. And for both preps, I have 2% chlorhexidine scrub and a 70% isopropyl alcohol rinse. So for the dirty scrub, I'm still going to try and just go down in a nice circular motion here. And just want a little bit quicker than for the final scrub. So that's just my dirty prep. I'm going to go ahead and get my patient moved to the OR. My patient has been moved into the OR where I'm going to go ahead and do my final scrub before the surgery begins. So anytime coming into the OR, I want to make sure that I have my cap and mask on and that I have my exam gloves before touching the patient. So we did our dirty scrub. For my final scrub, I'm going to use also 2% chlorhexidine scrub followed with a 70% isopropyl alcohol rinse. And I want to do each at least a minimum of 3 times or until my sponges come clean. So for my final scrub, I'm going to use a target motion. So I'm going to go ahead and just take a sponge. I don't want to touch the underside, it's going to touch the patient. I'm going to start at the incision site and just work in a counterclockwise motion out. Once I touch the hairline, I'm going to go ahead and throw away my sponge as I don't want to recontaminate the site. So, following my chlorhexidine, I'm going to take an alcohol sponge and with the same motion start at the incision site and work my way out. And at no point during the scrubbing do I want to go back over the incision site or anywhere that I've already scrubbed. So I'm going to do that again. Incision site, circular motion and out. Repeat that with my alcohol, incision site, counterclockwise circular motion. And I'm just taking a quick peek at all of my sponges afterwards to make sure that they're coming up clean. Alright, so this will be my last one. So I've got my chlorhexidine scrub. Start at the incision site, counterclockwise motion, and then without going back over, throw that away. I'm going to do that one more time with my alcohol prep. Alright, so that's my last one. It came off perfectly clean. If it were to be coming off dirty or anything like that, then I would continue with my chlorhexidine and alcohol rinse until it came back perfectly clean. But everything came back great. My patient is prepped and we are ready to go ahead and begin her stay.